BayRadio International. Our business is helping your business grow.
It's BayRadio on a Friday afternoon. It's World Health Day. And as we celebrate the World Health Organization's birthday, I suppose, 75 years. Yeah, I'm joined now by Dr. Lisa Richardson and Dr. Liz Riordan. And Dr. Richardson, if I can start with you, you're director at CDC's Division of Cancer Prevention and Control. Can you tell us about CDC and your role, please?
Yes, so I'm at the Centers for Disease Control in Atlanta, Georgia. And so what we have here as part of our sort of aspirational goal is all people free of cancer, which really aligns with Health for All in the World Health Organization, World Health Day. And so what we do here is look at the spectrum of cancer control from prevention, eating right, not drinking too much, those types of things, getting diagnosed if you're screened. And then what if you survive cancer, which in this country, most people do. What do you do after that? And how do you live your life more fully after you've had cancer?
Mm-hmm. Have you heard of a book called Anti-Cancer, A New Way of Life?
No, I have not. Mm-hmm.
It is amazing. It's been my Bible. I've been on the journey. It was my Bible. It was my go-to because it not only talks about cancer and the causes and what it goes a bit deeper. It talks about pre-war farming methods and how things have changed, haven't they, just, and how things creep past the FDA and things like that. But that's something we could get into, but we'd be here for far too long. So, but you know what I mean.
Yes.
On to Dr. Riordan. Tell us about your involvement.
So I'm a breast cancer surgeon who actually got breast cancer myself. I was 40 back in 2015. I never checked my breasts, hands up, because I thought it wouldn't happen to me. And I noticed a lump one day, and that was a stage 3 cancer. And I had a year of treatment and realized just how hard it was to go through the drugs I gave my patients every day, and how scary it was to be on the other side of the table with a list of questions I was too embarrassed to ask. In 2018, it came back on my chest wall, and the treatment for that meant I had to stop operating. So I now spend my time talking and educating patients and doctors about what it's actually like to have cancer, because you don't hear much when someone tells you the C word, and you come away with a long list of questions and you've no idea what to do. And through the Empowered Health program, I'm helping patients realize they have an equal seat at the table, so they can understand and ask questions and know what is happening to them, whether they've got primary or secondary cancer.
It's always good to have somebody with you that will remember stuff, because when you've got that coming at you, you forget most of it. There's certain little bits I wish I'd asked that. But, if you've got somebody with you that can remember it all for you.
Exactly. Or a website to go to where you can ask those questions, find out what you need to go the next time you come back, because it takes time for it all to sink in.
Mm-hmm.
As I was saying, this is a subject close to my heart. As when I went through this, early testing hadn't really reached our shores here. And I'm pretty certain what occurred could have been prevented entirely, I think. So this year's theme for World Health Day is Health for All. Dr. Richardson, can you elaborate on that for us, please? And what is the Empowered Health Program?
So Empowered Health, I want to speak to the point that Dr. Riordan made earlier, was that it really is a very scary time. It's really hard for you to hear what's being said. I'm a doctor that gives chemotherapy here in the U.S. And so one of my practices would be to talk with people and then have them back in a week or two to re-talk and ask questions. And so what Empowered Health is about is that on that website, we have information for the patient, for the providers who's seeing the patients, because, we may be providers, but as she said earlier, we don't know it all either, right? And especially the psychological part of having cancer is really something that none of us are taught about when we train to be physicians, none of us. And so that's really what Empowered Health is about. And Health for All, as I said earlier, is really about no matter what stage you are in your life, no matter what stage you are in whatever, health condition you're dealing with, information really does empower people, information that they can understand. And that is the goal of our program, Empowered Health.
And there's a website, isn't there? empoweredhealth.org.
Yes.
Is that right?
Absolutely. Mm-hmm.
Okay. Dr. Riordan, you've been through the journey yourself. So how did that affect you, and what's your role in the Empowered Health program?
So I think having had cancer myself, I realized how little I knew about what the patients go through, because they don't tell me as a surgeon or oncologist. They tell their family. So using this to help doctors realize how they can help their patients, especially when the treatments end, how to get their life back, the importance of exercise, how to talk about sex and relationships, all of that. I also want to use it to help encourage patients and the general public to know what the signs of cancer are, what to do if you're worried, and to go for screening. I never checked my breasts. I was too young to have a mammogram. That was the only thing I could do, and I didn't do it. And it's really important. Even if you find something and you're really, really scared, you have to get it checked out early, because that worry in your head can just be awful.
I agree, yes. So what can we say to somebody that's going through the early stages right now? What can we give them?
So I'll start, and then Liz can take over. I would say, again, go to those trusted places where you can learn about what you have. When you go in for your visits, I like to say there's no dumb questions, right? And if someone thinks your question is dumb, you need to move on to find someone who doesn't, right? And that just to learn as much as you can, inform yourself. And the one thing I did forget to say about, Empowered Health is that there's a section for caregivers. Those people are critical to making sure that you get what you need, you get to where you need to be. I don't know what your cancer experience was, Dougie, but sometimes you just need somebody to take you places because you just can't do it for yourself, right? And so it's really being mindful of those who support us as we go through the health problems that we have, and especially cancer. It's such a complicated process with chemotherapy, radiation, surgery, and we do need that help to get through it.
Yeah, I have to say the caregiver, whether it be a spouse or friend or whatever, they often get overlooked, don't they?
Yes.
We need to take our hat off to them. They do a great job. And I mean, I was helped, 10 years ago, and I'm still being helped through it. You know what it's like. So Liz, what about you?
I think for me, it's encouraging cancer patients to stay as healthy as they can, because we know if you exercise regularly, if you eat well, it improves the side effects of drugs. It makes the treatment more effective. It reduces the risk of it coming back. And we are talking about health for all. And if we can all adopt a much healthier lifestyle, it will reduce the risk of cancer and help cancer patients stay alive for longer. As
I said earlier, if there's somebody going through it, or they've got an inkling there might be something not quite right, what's the first step?
Go to your GP, make an appointment, get it checked out. You have no control over what this is. It may be cancer, which may be a terrifying thought, but the longer you wait, if it is a cancer, it could start to grow and spread. So if you are worried, you've had something for 2 or 3 weeks that you can't explain, see your GP, tell someone, get it checked out.
Now, I just want to add that we need to understand that there are things we can do: eat healthy, exercise, and not to be too hard on yourself, because we all are. If you can't do it every day, get up the next day, it's a new day, and start again and try again. So just one of those things about keeping a positive attitude and trying to work, just keeping a positive attitude. Yeah.
Excellent words. I'm taking that in for me. I'm having some of that. Thank you. Thank you very much, Dr. Richardson and Dr. Riordan. Thank you very, very much for joining us, and happy Easter.
Yes,
you too. Thanks, Dougie.
Thank you. Thanks, Dougie.